We've said it, it's been a warm summer already, but get ready for our hottest days yet. It should feel like 100 to 110 degrees tomorrow and Thursday. Joining me now to talk about that, Dr. Trevor Lewis, Chair of Emergency Medicine at Cook County Health. Doctor, thanks for being with us.
Thanks for having me.
Well, when you hear that the temperature is going to be that hot, what do you brace for from your point of view as a care provider?
Sure. So obviously very concerning. It's not just the high heat, but it's the high humidity. And that humidity really impairs our body's normal mechanisms for getting rid of heat. So you have to be very careful when you're out of this heat, prepare for it, and really know what to look for.
What can we prepare for, and run down for us the things we should keep an eye out for in ourselves or the people around us?
Absolutely. So if you want to prepare, what you want to do is first and foremost hydrate, drink maybe 8 to 12 ounces of fluid before you go out. And then if you're out and about, maybe 6 to 8 ounces every 20 to 30 minutes. You want to wear loose fitting clothing. Usually light clothing will reflect the sun. If you're wearing dark clothing, that'll actually absorb the sun. And then what you want to do is you want to recognize signs and symptoms of two things. One is heat exhaustion. And what that is, you might feel dizzy, you might feel nauseous, maybe a headache, or you start sweating profusely. If this happens, you want to try to remove yourself from the heat or the sun and start hydrating, seek a cooler environment. The bigger thing, though, to really look for is signs of heat stroke. And this is if you start to become confused or someone you're with becomes confused. With heat stroke, the body actually stops sweating. You'll have hot, dry skin. Maybe you'll have episodes of passing out or difficulty walking. That's a true emergency, and you need to seek medical help immediately.
Sure, that's when it really elevates and gets scary. Doctor, some of these tips that you give us, I can see, some people maybe rolling their eyes like, sure, I should drink water, okay, light clothing. But I don't doubt that you see people, come in for treatment that didn't necessarily pay attention to the simple things and then find themselves dealing with either heat exhaustion or heat stroke.
Correct. I think the big thing is you just want to stay ahead of things. It's great if you can be at home in air conditioning, but that's not possible for everybody. So know where you can go to get cool. You can go to malls, there's cooling centers, there's pools. If you're at home by yourself, you can certainly take cool baths or cool showers. I think these are all things that you want to do. And more importantly, I think you want to keep an eye on your neighbors, especially elderly neighbors. They sometimes have a harder time dissipating the heat. They might not have effective cooling in their house, so you want to check on them. And I think you also want to keep an eye on the very young and the very old, keeping them out of the sun. Young children can't tell you when they're starting to feel these symptoms. So if they're starting to become tired, if they're very little activity, vomiting, you really need to get them out of the sun right away.
Yeah, we have to look out for each other in conditions like this. Dr. Trevor Lewis with Cook County Health, thank you so much for your tips and for your time today.
Thank you.